Hi, hello everyone. Welcome to Farre Series, Forensic Medicine and Toxicology. Am I audible? Yes, good evening everyone. Welcome to Farre Series, Forensic Medicine and Toxicology. Am I audible and visible? Yes, Wasama Sheikh. Okay. Hi everyone, just say hi everyone in the chat box. Hi, hello, vanakkam, namaskara. Anything in the chat box? Yes. So in this session, we are targeting your university exam. So basically a theory exam. So as you know, forensic medicine, one paper in exam, one paper, 100-mark paper in university exam. So we're discussing most important question like important long essays, important short essays, and very important short answers. Yes, hello. Yeah. So, in the beginning, we are discussing what is the distribution of topics in your theory exam. So, forensic medicine distribution of marks in suggested blueprint of question paper, that is your university exam as per CBME curriculum. Yes. Okay. Hi, Rich. So, total mark is 100 mark, one paper in your exam. It is divided into general forensic medicine. So, general forensic medicine means dying declaration, that can be a 5 marks question, or dying deposition, that can be a 3 marks question. Differences between dying declaration and dying deposition can be a 5 marks question. Then medical records can be a 5 marks question, and cause of death in various cases. So it's around 5 mark general forensic medicine. Then comes is very important topic, forensic pathology. In forensic pathology, the important topics are thanatology. Thanatology means study of death and changes, like postmortem changes, very commonly asked main question. Classify postmortem changes. What is the pathogenesis of rigor mortis? What is the differential diagnosis of rigor mortis? And medico-legal importance. Very commonly asked question. Then comes is your medico-legal autopsy. Medico-legal autopsy, like what are the types of skin incision, what are the techniques of autopsy in postmortem examination. Then mechanical asphyxia, one very important topic. Hanging, suffocation, drowning, strangulation are frequently asked question. Thermal death, death due to starvation, neglect, infanticide, 25 marks. Okay, 25 marks. Okay. Then clinical forensic medicine. So clinical forensic medicine means Identification. One frequently asked question is dactylography or fingerprint. Very frequently asked. 5 marks question, 3 marks question. Mechanical injuries. Very commonly asked in practical forensic medicine and viva question. Injury certificate, classify mechanical injuries, types of stab injuries, types of incised wound. Very frequently asked. Then firearm injuries. What are the differences between entry wound and exit wound? Asked more than 50 times in last 10 years. Regional injuries, skull fractures, Pape's rule, hemorrhages, extradural hematoma, subdural hematoma, all this. Then comes his sexual offenses. One very important topic in forensic medicine, comes under clinical forensic medicine. So define rape 375, or what is the definition of rape as per BNS, Bharatiya Nyaya Samhita? Virginity, pregnancy, abortion, impotence, sterility, sterilization, all this comes under clinical forensic medicine, around 25 marks. Okay, general forensic medicine 5 mark, forensic pathology around 25 marks, clinical forensic medicine 25 marks. So then comes is your medical jurisprudence, 15 mark. In that very commonly as topic is bioethics, euthanasia, medical law and ethics. Okay, euthanasia, one frequently asked question in exam. What are differences between passive euthanasia and active euthanasia? Okay, what are differences between civil negligence and criminal negligence? What are the types of inquest, police inquest, magistrate inquest? All these are frequently asked. That is from your medical jurisprudence. Application of your legal knowledge in medicine is known as medical jurisprudence. Then principles of bioethics can be a 5 marks question. Forensic psychiatry around 5 mark. So in forensic psychiatry, some important questions like 5 marks questions, differences between feigned insanity and true insanity, are types of delusion, medico-legal importance, types of hallucination, medico-legal importance, types of impulse disorder, medico-legal importance. All these are frequently asked question. 5 mark. Yes. Next comes is your general toxicology. General toxicology around 25 marks. Not only general, so entire toxicology around 25 marks. It includes all biotoxicology, socio-medical, environmental, all this, snakes and all. So 25 marks. So entire forensic medicine as per CBME curriculum, it is divided into 6. General forensic medicine 5 mark, forensic pathology 25 marks, clinical forensic medicine 25, medical jurisprudence 15, forensic psychiatry 5, general toxicology including entire toxicology around 25. So am I clear, guys? Shall I move ahead? Yes, can anyone reply me in chat box? Okay, now we are going to start one very important topic, that is your hanging, that is asphyxial death. Okay, asphyxial death. So the next topic is asphyxial death. So we are going to discuss about some important questions in asphyxial death. So what are the important topics in asphyxial death? The one is hanging. Hanging, that is what visible in the image, hanging. Then comes is your drowning. Drowning is very important, guys. So it can be main question, 10 marks question or 5 marks question. Drowning. Sometimes they can ask you suffocation. Suffocation types. Suffocation. There are many types of suffocation. Then comes is strangulation. Strangulation. So what are the four important topics in asphyxial death? Hanging, drowning, suffocation, strangulation. Strangulation usually a 5 marks question. Sometimes the question can be asked differences between hanging and ligature strangulation. Or what are the postmortem findings in throttling? So the four important topics in your asphyxial death. Yes, Kishore? Yes, fine. So the topic number one, that is hanging. So it's a very commonly asked long essay. The question can be like this: define hanging. Define hanging. Types of hanging. Cause of death. Postmortem findings. Medico-legal importance. A typical question from asphyxial death. Okay. So the mark divided into 1 plus 1 plus 1, 5 plus 2, like that. Or sometimes they can give you a scenario. So a suspected case of hanging. So the findings are these: dribbling of saliva, something like that. So the question can be asked at the end: define hanging, what are types of hanging, or what is the cause of death in above case, what are the usual postmortem findings, and what is the medical legal importance. So this is how the question can be asked in your exam. Yes, fine. Okay. Now let's start with the long essay, that is hanging. So what is the definition of hanging as per K.S. and Reddy, 35th edition, page number 262? You need to define properly. So what matters in your theory exam is the proper answer, the proper definition, and the proper findings from the standard textbook. So the concepts are very important in theory exam as well as MCQ exam as well, both. Yes. So hanging is defined as is a form of asphyxia caused by suspension of body, suspension of the body, okay, by a ligature material, encircling neck, encircling neck. The constricting force being either weight of the body or the weight of the head. So this is the standard definition of hanging. So that you need to write in the exam. So hanging is a form of asphyxia caused by suspension of body by a ligature material, encircling neck, constricting force being weight of the body and weight of the head. So let me discuss the concept in the definition. The question can be asked in your exam. Define asphyxia, 3 marks question. Define asphyxia. Anybody, what do you mean by asphyxia? Can anyone tell me what you mean by asphyxia? Yes, guys. Anyone in the chat box? What do you mean by asphyxia? What is the literal meaning of asphyxia, and what is common meaning of asphyxia in general? Anybody? Yes, Ridhima Saxena. Yes, some definition you must know, Ridhima, especially definition of hanging, definition of McNaughton's rule, true insanity, that you need to write in the exam. Or injury definition, hurt definition, grievous hurt. So some definition you need to know very well, not all. Our definition of medical negligence, definition of 4Ds of medical negligence. So all definition you must know. Res ipsa locator. Okay. So very good, Sumana De. Sumana De, excellent answer. So she said, sir, asphyxia means pulselessness. Very good. The literal meaning of asphyxia is pulselessness, guys. Asphyxia is equal to, in general, hypoxia plus hypercapnia. Hypercapnia. So try to memorize this. Asphyxia is equal to hypoxia and hypercapnia. So because of this finding, there will be cyanosis. Cyanosis is a very important finding in hanging. Why? Why? Because of decreased oxygen concentration. Then there can be hypercapnia also because of the constriction around the neck. Okay, the veins, arteries, trachea all constricted. Because of that, there can be asphyxia and death. Very good. So Dharmena Yadav, good, beta, good. You are attending class from Nepal. That is really nice. Good. So this is the point number 1 you need to mention. Suspension of the body. This word is important, guys, here. See, try to understand. In hanging, there is a suspension of the body. So there is no suspension in strangulation. So try to understand. So suspension word we use in case of hanging. Actually, literal meaning of hanging is suspension only. So suspension of the body is not there in strangulation. That is there only in a hanging. Biligature material. Encircling neck. So it encircle neck. So what is the appearance of ligature mark? Your answer should be oblique ligature mark. So ligature mark is oblique. Ligature mark is oblique in nature. Can anyone answer what is the direction of ligature mark in ligature strangulation? Let's make it interactive, guys. What is the appearance of ligature mark in ligature strangulation? I said oblique in hanging. Yes. Yes, so Dharmena Yadav, Sumana De, good. Yeduvan Shimanu. Yes, yes, yes. Good, guys, good. Good. Anybody? I said oblique ligature mark, like this. Oblique ligature mark is seen in case of hanging. What is the appearance of ligature mark in ligature strangulation? That is usually murder. Murder. Okay. Yes. Yes, Sumam. It is transverse. Very good answer. Sumana De answers it is transverse. Good answer. So this is the point you must know. Then you can say one more important point here. Weight of the body. Weight of the body is a constricting force in case of complete hanging. Weight of the head acts as a constricting force in partial hanging. So there are 4 important key words in definition. Asphyxia, literal meaning is pulselessness. There is no suspension of body in ligature strangulation or strangulation. Ligature mark is oblique in hanging. Ligature mark is transverse in ligature strangulation. Body weight acts as a constricting force in complete hanging. In case of partial hanging, it is weight of the head. So this is what you need to understand. Yes, okay, Suman, everybody, fine. Okay. Now, what are the signs of hanging? What are general signs of asphyxia? You can remember the mnemonic. A is equal to CPC. A is equal to CPC. So all of you write. Triad of asphyxia. A is equal to CPC in the chat box. Keep writing, guys. Keep writing some points. You can interact with me in the class. So in any case of asphyxia, we normally see 3 important findings. The mnemonic is CPC. So all of you write CPC in the chat box. Let me explain this. What is CPC? So A for asphyxia. Asphyxia is equal to C for cyanosis. C for cyanosis. What do you mean by cyanosis? Bluish discoloration of the nail beds. Bluish discoloration. P for petechial hemorrhages. P for petechiae. And one more C, that is the congestion. So that is congestion. So 3 important findings you need to mention in your exam. So there are 3 findings. Mnemonic is CPC. C for cyanosis, petechiae, congestion. They are all seen in any type of asphyxial death. Any type of asphyxial death. So try to understand this. Okay. So you can see here three important finding. So what are three important findings? Cyanosis, petechiae, congestion. So the next topic is types of hanging based on the level of suspension. So what are types of hanging based on the level of suspension? So one is complete hanging. The second one is incomplete hanging, also known as partial hanging. So you can see here. So this is the complete hanging. Complete hanging. This is partial hanging. Partial hanging. So the partial hanging, so can be in standing position, or it can be a sitting position, a kneeling position, prone position. So in partial hanging, some of the body part touching the ground. In case of complete hanging, no body part is touching the ground. And again, one more point, try to remember. So in case of complete hanging, weight of the body acts as a constricting force. In case of partial hanging, weight of the head acts as a constricting force. So this is one classification based on the level of suspension. Second classification based on the position of knot. So there are again two types are there, A and B. Can anyone identify what is this A and B based on the position of knot? So when knot is there at the nape of the neck, so at the nape of the neck or at the back of the, that is head, so at the nuchal prominence, so that is known as typical hanging. Typical hanging. So based on the position of knot, hanging classified into typical hanging, atypical hanging. Typical hanging means when knot is present at the nape of the neck. Atypical means anywhere other than the nape of the neck. So anywhere other than the neck, other than the nape of the neck, the position that is known as atypical hanging. So hanging classified based on the position of knot, based on the suspension also. One more classification based on the intent. Based on the intent, it is classified into suicidal, homicidal, accidental, and judicial. So anybody, what is the commonest manner of suicide, manner of hanging? What is the commonest manner of hanging? Is it suicide, homicide, accidental, judicial? Can answer very simple question, guys. Very simple question. So judicial, remember there will be C2, C3 fracture. Okay. Accidental commonly associated with autoerotic hanging. Autoerotic hanging, also known as sexual asphyxia. Homicidal hanging, also known as lynching. Lynching. The suicidal one is the most common one. So most common one. Yes, good point. Fine. Okay. So I'll repeat again, guys. So in exam, you need to write proper definition. So hanging is a type of asphyxia. So characterized by an oblique ligature mark around the neck. So and A is equal to CPC. So A, that is asphyxia, C for cyanosis, C for congestion, P for petechial hemorrhages. Classification of hanging based on the knot position, typical, atypical. Based on the suspension, it is a complete hanging, a partial hanging. Based on the intent, suicidal, homicidal, accidental, judicial. The commonest one is suicidal. Homicidal hanging, that is known as lynching. Accidental hanging, that is associated with sexual perversion, which is known as autoerotic hanging. So judicial hanging, which is a method of judicial execution in India. So there will be fracture of C2, C3, C4. Yes. So this is about the classification. If you write, you will get 1 mark. Then comes is the cause of death. So what is the cause of death in case of hanging? So the commonest cause of death, that is asphyxia. Okay. The commonest cause of death, that is asphyxia. So because of the occlusion of the trachea, so the weight required is 15 kg. So for occlusion of trachea, the weight required or the force required is 15 kg. Anybody, what is the weight required to occlude carotid arteries? Can anyone answer? What is the weight required to occlude the carotid arteries, jugular veins, vertebral artery? Can anybody answer? Let's see who is going to answer this question. So for occlusion of trachea, 15 kg, carotid artery, what is the weight required? This can be Viva question, guys. Viva question. Very good, Sumana, they answered. So it's around 5 to 6 kg. 5 to 6 kg. So carotid artery 5 to 6 kg. Jugular vein around 2 to 3 kg. Vertebral arteries VA around 20 kg. So this can be a Viva question in your exam. So what is the weight required to occlude your trachea? Sir, it is 15 kg. Carotid artery 5 to 6 kg. Jugular vein 2 to 3. Vertebral artery is 20 kg. Very simple it is. So next is the venous congestion. So sometimes the cause of death can be venous congestion because of the occlusion of jugular veins. The weight required is 2 to 3 kg in case of partial hanging. So try to memorize, guys. If the question asked in your exam, what is the commonest cause of death in case of partial hanging? It is probably venous congestion. Venous congestion. Okay. Yes. Venous congestion. Himanshu. Okay. So sometimes there can be combination of asphyxia and venous congestion. Again, it all depends on the weight. So for trachea is around 10 to 15 kg. So jugular vein, external carotid artery around 2 to 3 and 5 to 6 kg. So the most common one is asphyxia and venous congestion. Sometimes it can be a dislocation of cervical vertebra in case of judicial hanging. Judicial hanging, JH, that is known as hangman fracture. Hangman fracture. Hangman fracture. Can anyone answer what do you mean by undertaker fracture? Anyone in the chat box? Undertaker fracture can be an MCQ in your exam. So there will be 10 MCQ in some universities. Okay. So what do you mean by undertaker fracture? I said hangman is C2 fracture. Undertaker fracture. Yes. Anybody? So dislocation of cervical vertebra and judicial hanging. Reflex vagal inhibition. You know, vagus nerve is inhibitory in heart. When vagus nerve is stimulated, there can be sudden stoppage of the heart. So that can be cause of death in many conditions. So that can be in case of hanging also. Reflex vagal inhibition. Cerebral anemia. So because of the occlusion of vertebral arteries. So in standard textbook, so there are 6 causes of death mentioned. What are they? Asphyxia, venous congestion. The third one is the combination. The fourth one, dislocation of cervical vertebra. The fifth one, reflex vagal inhibition. Last one is cerebral anemia. What do you mean by undertaker fracture? Anybody? Can anyone answer? Undertaker fracture is a fracture of C7. Okay, C7. This can be postmortem artifact in case of transport of dead body. Okay, when neck is unsupported, there can be fracture of C7. So the fracture of C7 known as undertaker fracture. Skull fracture can be a 5 marks question. Okay, so and this can be all MCQ type in exam. Yes, guys, good. Then the fatal period. The fatal period is around 3 to 5 minutes. 3 to 5 minutes. Okay. So next comes is your very important topic, that is postmortem finding. So what is important in forensic medicine is the postmortem findings. You need to write what are the external postmortem finding, what are the internal postmortem finding. So what are the causes of death, or what is the medico-legal importance of this condition. This is how you need to write in the exam. So in most of the answer you need to write medico-legal importance and also postmortem findings. Okay, yes. So next heading is, that is postmortem finding. So can anyone tell me what is the postmortem finding in the picture given there in a case of hanging? So it's a case of hanging. What is the finding here? Yes, guys. Yes, anyone? What is the finding here? Let's see who is going to answer. Sumana De, Himanshu, Nibir. Dribbling of saliva from the angle of mouth. Very good. So very good answer that is given by one of the student. So Sumana De answers, a dribbling of saliva is there. Very good. So this is dribbling of saliva. So dribbling of saliva is a very important finding in ante-mortem hanging. That shows that at the time of hanging, he was alive. He was alive. That means there is a dribbling of saliva. There is a stimulation of salivary gland. So when there is a stimulation of salivary gland, when there is a pressure over the salivary gland because of the ligature, there can be dribbling of saliva. One very important finding. Yes, any other? Any other finding? You can see around the face, around the mouth, around the lips, you can see there's a finding because of hypoxia and hypercapnia. What is that? Yes, so dribbling you've answered. That's really nice. Dribbling of saliva, that's fine. You can see cyanosis. Cyanosis also you can see. You can also see congestion, guys. Congestion is there. What else? Anybody? Yes. Cyanosis, fine. Let's see what are the findings in case of hanging. External finding. Face. When you see the face, you will see cyanosis around the lips, around the tip of the tongue. Congestion in case of partial hanging. In case of complete hanging, the face can look pale. It looks like pale appearance. And also there can be petechial hemorrhages. So small hemorrhages, pinpoint hemorrhages over the face. So that can be seen. Dribbling of saliva. Okay, so dribbling of saliva is because of the pressure over the salivary glands. It is usually present opposite to the side of knot. It is a finding in case of ante-mortem hanging. Good. Yes. Then comes is your neck. What is the finding over the neck? So the finding over the neck, the very important finding is ligature mark. So what is the appearance of ligature mark? Is it oblique or transverse, guys? Normally, is it oblique or transverse? Anybody can answer. So over the neck, you can see the ligature mark. So ligature mark can be black color or brownish color. Okay, dry, hard parchmentization that is seen over the neck. Okay, yes. Yes, guys, what is the appearance of ligature mark over the neck? Oblique ligature mark. Oblique ligature mark. Oblique ligature mark above the level of thyroid cartilage. In around 80% of the cases, it is above the level of thyroid cartilage. Okay, oblique, very good. Then there can be tardive spots. Tardive spots. There can be pinpoint hemorrhages. Okay, tardive spots are pinpoint hemorrhages. Pinpoint hemorrhages. They are seen over the eyelids. They are seen over the surface of heart, surface of lung, sclera, conjunctiva. So there are multiple tardive spots because of the asphyxia. Then there can be postmortem finding, postmortem staining. They usually seen over the lower part of the upper limb, lower part of the lower limb. So that is known as glow and stalking postmortem staining. Glow and stalking. Okay. And the last one, there can be a sphincter relaxation. Because of that, there can be involuntary expulsion of the feces or the urine, or there can be seminal discharge. So these are 5 important findings you need to mention in the exam. You need to write external finding. Over the face, you will see congestion, cyanosis, petechial hemorrhages, dribbling of saliva present opposite to side of knot. Okay, it is also showing that it is a case of antemortem hanging. Neck, you will see oblique ligature mark, dry hard parchmentization above the level of thyroid cartilage in 80% of the cases. Tardive spots are seen over the sclera, eyelids. Okay, they can be seen over the internal organs as well. Postmortem staining commonly seen in lower part of the upper limb and lower part of the lower limb, which is known as glow and stalking postmortem staining. Sphincter relaxation because of the hanging and asphyxial death. So because of that, there can be involuntary excretion of feces and the urine. So all these are the 5 important findings. So anybody now look at this image and identify what is the finding in case of hanging. Anybody? Can anyone? What is the finding in case of hanging? So in case of hanging, sometime the one eye is open, other eye is closed. On the same side of knot. On the same side of knot because of compression force over cervical sympathetic chain. What is this finding in case of hanging? Anyone? Yes, Sumana, they answered. Sir, this is known as lay faces sympathetic. Lay faces sympathetic. It is seen in 1/3 of the cases. 1/3 of the cases, it is a feature of antemortem hanging. Antemortem hanging because of compression over cervical sympathetic chain. Said very well. What is the finding here in case of hanging? External finding we discussed already, guys. You can see pinpoint hemorrhages over the eyelids. The size is around 0.1 to 0.2 millimeter. It is not hemorrhage. They are petechiae. We can call it as petechiae. What are these spots are known as? Okay, fine. ठीक है. Yes, good. So all these are known as tardive spots. Tardive spots. Okay. Is it okay now? Abukar Ahmad, is it okay? So this is the finding in case of hanging. we discussed already. So this is postmortem staining. Postmortem staining. So glow and stalking. Glow and stalking type. Yes, fine. Okay. Yes, guys, have understood all the 5 important features? Yes, guys. External finding, have you understood? All these points should be there in your answer sheet. External findings. Is it clear, guys? Yes or no in the chat box? Yes, gaming, yeah, fine. So, next, internal finding. So, what are the internal finding? What are the internal finding in case of hanging? Subcutaneous tissue of neck. See, when you see subcutaneous tissue of neck, you will see ligature mark. You will see ligature mark. So ligature mark, when you see, it is dry and hard. Okay, dry, hard. It looks like a parchment paper. Okay, this is very important, guys. In case of hanging, subcutaneous tissue beneath the ligature mark, which is dry, hard, and it looks like a parchment paper. In case of ligature strangulation, it is soft and edematous. So the point you need to mention here in exam, ligature mark, when it is soft and edematous, in case of ligature strangulation. Ligature strangulation. So this is the point you need to write in the exam. Okay. And hyoid bone. When you see hyoid bone, so there will be fracture of hyoid bone. So in case of ligature strangulation also there is a fracture of hyoid bone. Throttling also there is a fracture of hyoid bone. Hanging also there is a fracture of hyoid bone. Anybody can answer what type of fracture is common in hanging? What type of hyoid bone fracture is common in case of hanging? Yes, anybody? Hyoid bone, you know, hyoid bone has a body, it has a greater carnu and lesser carnu. So my question is, what type of fracture? Is it an inward fracture, outward fracture? Is it an adduction fracture, abduction fracture, traction fracture? Anybody? Anybody, guys? So hyoid bone, there will be abduction fracture. Abduction fracture. So at the junction of inner 2/3 and outer 1/3 of greater carnu, abduction fracture. Adduction fracture is seen in throttling. In throttling, it is adduction fracture. In case of hanging, it is abduction fracture. You can see this image here. So this is the image showing abduction fracture. So outward compression fracture. It is also known as outward compression fracture. In case of throttling, you can see inward compression fracture, also known as adduction fracture. You can see very clearly here. So when fracture segment is abducted, that is known as abduction fracture. That is known as outward compression fracture. That is seen in case of hanging, also in case of ligature strangulation. When fracture segments are towards the midline, they are known as adduction fracture. They are seen in case of throttling. Okay, throttling. So this is very, very important finding. Very, very important finding you need to memorize. And also types of hyoid bone fracture can be a 3-mark question. What are the types of hyoid bone fracture? Your answer should be outward compression fracture, inward compression fracture, traction fracture and all. Okay, yes. So this is the second point about the hyoid bone, abduction fracture. The point number 3, carotid arteries. When you see carotid artery, there can be intimal tear. The intimal tear is known as Amsuth sign. Amsuth sign. So in case of hanging, when you see carotid artery, in the intima of a carotid artery, you will see tear. The tear is known as Amsuth sign. Okay. Vertebra. When you see vertebra, there can be collection of hemorrhages. These hemorrhages known as Simon hemorrhages. Simon hemorrhages. Again, non-specific finding. Simon hemorrhages. Lungs. Lungs are congested. So most of the organs are congested, including lungs. Brain, other viscera, congested. So most of the organs are congested. So all these are internal finding. Okay, so very important is the over the neck. Over the neck you will see oblique ligature mark, dry hard parchmentization. There are no other ecchymosis or bleeding into the subcutaneous tissue. So that is the very important finding. Head bone you will see abduction fracture. Carotid artery you will see Amsuth sign. Vertebra, Simon hemorrhages. Lungs are congested. Not only lungs, brain, other viscera, all are congested only. Yes guys, I have understood this funda. Shall I move ahead? So this is the abduction fracture and adduction fracture. You understood guys? Shall I move ahead? So next is medico-legal importance. Medico-legal importance, already we discussed suicide. Okay, this is the one of the commonest method of suicide. Homicide, that is known as lynching, we discussed already. Lynching is nothing but homicidal hanging. Accidental, in case of autoerotic hanging. Autoerotic hanging, also known as sexual asphyxia. Sexual asphyxia. So commonly associated with transvestism, okay, and also fetichism, autoerotic hanging. So accidental death. So while during masturbation, so because of the accidental death. Judicial hanging. So there is a fracture of C2, C3 and C4. In judicial hanging in India, the site of knot is submental position. Submental position. The site of knot in most common in India, it is left angle of mandible. Left angle of mandible. Okay, so if you write this, so this will complete your main question. So define hanging, types of hanging, what is the cause of death in case of hanging, what are the postmortem findings, external, internal, and lastly you need to write medico-legal importance. So this is how you need to write in the exam. Yes, fine. Now you need to identify one asphyxial death here. Let's see who is going to identify this asphyxial death. So there is a demonstration of asphyxial death. What is this asphyxial death? A type of strangulation. Anyone? Let's see who is going to answer this. Yes, Sumana De. So this is a type of strangulation, a constriction of neck at the elbow bend or the knee bend, so which is known as mugging. Very good. Mugging can be a 3 marks question. So this is mugging, guys. So what is the cause of death in mugging? Asphyxia. So the question also can be asked about Ban's Dola. 3 marks question. Ban's Dola and the cause of death. Mugging and the cause of death. Question can be asked about Burking method. Burking method, a 3 marks question. So after the class, go through all these types of strangulation. Yes, good. So next, some questions about medico-legal autopsy. So usually 3 marks question asked from the medico-legal autopsy. Mention the types of skin incision during autopsy. 3 marks question. So what are the types of skin incision? So during autopsy. Anybody can name one type of skin incision? So there are many types. So this is the commonest type. Eye-shaped incision. Eye-shaped incision. Eye-shaped incision is the one which is extending from your okay, that is mentis, okay, submental area to that is your pubic symphysis. So this is your eye-shaped incision. Eye, which is the commonest one. The second one, Y-shaped incision. So what is eye-shaped incision? Eye-shaped incision is from chin to pubic symphysis. So which is the commonest skin incision. The second one is Y-shaped incision, that is extending from acromion then to the Giffard process. Giffard process like this, then to the pubic symphysis. Pubic symphysis. So this is Y-shaped incision. So Y-shaped incision, it is having cosmetic importance. Cosmetic importance. So one more type, modified Y. You can see here, this is the modified Y. Anybody? What is the use of modified Y incision? What is the use of modified Y? Which is extending from your, that is behind the ear, then to the acromion, from behind the ear, then to the your mid-clavicular point, from the mid-clavicular point to your sternum, sternal joint, then to the pubic symphysis. So what is the use of modified Y incision in forensic medicine? So it starts from below the ear, then to the midpoint of clavicle, from there sternal angle, then to the pubic symphysis. Anybody? Modified Y? Yes, good answer. So modified Y is used in case of strangulation or in case of hanging. So in case of any case of neck injury, so modified Y incision is done. So what are the 3 common types of skin incision? One is eye-shaped incision, Y-shaped incision, and the third one is modified Y incision. Okay, so eye is the commonest one. Y is commonly having cosmetic importance, where it starts from acromion to Giffard process to pubic symphysis. Modified Y is done in case of neck injury, in case of hanging and strangulation. And there are some more incisions are there. What are they? X-shaped incision. Okay, X-shaped incision. X-shaped incision done in case of custodial death. Custodial death. One more is there, T-shaped incision, which is a subclavicular infection, subclavicular incision. Subclavicular. Yes, you can see here all the 5 types here. All the 5 types. So this is your I, Y, modified Y, X-shaped incision, T-shaped incision. All incision you can see here. So all these are the types of skin incision. So it can be a 3 marks question. So if you mention this, more than sufficient. Yes. Now one more question asked in exam. What are the techniques of autopsy? One more very commonly asked question. What are the techniques of autopsy? So there are 4 techniques. What are the 4 techniques? Lay-to-lay technique, Virchow technique, Gone technique, Rokitansky technique. Okay. So lay-to-lay, Virchow, Gone and Rokitansky. So lay-to-lay, what do you mean by lay-to-lay? Lay-to-lay means en masse dissection and organ separation. So all the organs are removed at a stretch. So from tongue to prostate, all the organs are removed at a stretch. That is known as en masse removal of organ or evisceration. So that is known as lay-to-lay. Lay-to-lay is the best technique. So remember the word lay-to-lay is equal to en masse. En masse. You know, en masse meaning is all the organs are removed at a stretch. En masse vaccination, I know, like that. Right. Virchow. Virchow means individual organ removal. Like you are going to remove the kidney, you are going to remove the liver, you are going to remove the lung separately. So that is known as Virchow technique. That is also known as 1-by-1 technique. So individual organ removal. So that is known as Virchow, which is the commonest one. Most common one. Most common one. Gone technique. Gone technique is a modification of your en masse technique, which is also known as separate block dissection. So separate block dissection. In Gone technique, we are going to remove the organs in 3 blocks. So what are 3 blocks? Cervicothoracic block. Cervicothoracic block. So all the cervical and thoracic organs are removed in 1 block. So they are removed at a stretch. Then abdominal organs at 1 more block. Abdominal organs. Lastly, pelvic organs. So in Gone technique, we are going to remove all the organs in 3 blocks. What are 3 blocks? Cervicothoracic, abdominal and pelvic. So this is known as Gone technique. And the last one is Rokitansky. The Rokitansky means organ dissection in situ. Organ dissection in situ, which is commonly done in case of infected dead bodies. Infected. So like in case of HIV positive, COVID-19 positive. So in all these infected bodies, so the dissection we do is in situ dissection. Okay, so this is about the techniques of autopsy. So all of you have understood this techniques of autopsy? Say yes or no in the chat box. Everyone say yes or no. 3 marks question can be asked. Rajan, everybody. So there are 4 techniques of autopsy. The first one is the best technique, lay-to-lay technique. All the organs are removed at a stretch from tongue to prostate. Second technique is a Virchow technique where individual organs are removed and they are dissected. That is the most commonest one. Gone technique, we are going to remove the organs in 3 blocks. What are 3 blocks? Cervicothoracic, abdominal and the pelvic. And the last one is the Rokitansky, which is in situ dissection, which is done in case of infected bodies. Infected bodies. So if you know this, more than sufficient. And one more 3 marks question, very commonly asked in your exam. Write about components of routine preservation of viscera. So anybody? So what are the organs preserved in case of poisoning? Anyone can answer? Yes, come on, guys. Come on. Yes, come on, guys. What are the organs preserved? So organs are preserved in case of poisoning, or in case of some unnatural death, unknown dead bodies, when there is a suspicion of some poisoning. Okay. Yes, liver, kidney, stomach, spleen. Okay, okay, good. So Roshan Singh answered. So liver. The first one is stomach and stomach contents. Okay, stomach and stomach contents. Okay. So this is the bottle number 1. So in bottle number 1, so example, this is the bottle number 1. In bottle number 1, stomach contents and also contents of the small intestine, duodenum. So this is very important, guys. This is very commonly asked in your Viva also. What is there in bottle number 1 of organ preservation? So the bottle number 1 consists of stomach, duodenum and its contents. So this is bottle number 1. So bottle number 2, that consists of liver along with the gallbladder around 500 gram. Kidney, half of the each kidney. Half of the each kidney. It is bottle number 2. So there are 5 bottles in organ preservation. The bottle number 1, stomach, intestine and contents. The bottle number 2, that is liver, gallbladder and the kidney. The bottle number 3, that is the blood around 10 ml, that is usually taken from femoral vein. The common preservative is calcium oxalate along with the EDTA and also urine. So that is the 4th bottle. Okay, 4th bottle. And the last bottle that consists of your preservative. Okay, the bottle number 5 that consists of preservative. So what is the most common preservative? Anybody? What is the most common preservative? Yes, Roshan Singh, the most common preservative is, that is saturated solution of NaCl. So that is the most common preservative. Yes, so you can see here, this is how we are going to preserve the organs. Yes, fine. If you have any doubt, you can ask me. Yes, Ridhima Saxena and others. Any doubt? Any doubt about these questions and answers? Okay, fine. Fine, guys. So tomorrow we are having one more session. So in that session, we are going to discuss some more important Farre questions, long essays and short essays and short answer. Thank you all.